Hi class, my name is Tina Dunn. I wrote a report about drug addiction. My thesis is going to provide you with the information about what drug addiction is and what are the different types of drug addiction and what can you get for the help and the signs and symptoms that they may endure. Addiction is a biopsychological disorder characterized by repeated use of drugs or repetitive engagement in a behavioral manner. It's also called a substance use disorder. It is a disease that affects a person's brain and behavior and leads to the inability to control the use of their mind and body. There are several types of drug addictions that I'm going to explain to you today. The first type is called inhalants. The inhalants is the deliberate inhalation of a vital substance to exhaust and alter mental state. The examples of this is dizziness, nausea, vomiting, irregular heartbeats, and tremors. This is examples of this is fentanyl, spray paint, different things like that cause them to inhale it. It is very dangerous and very toxic by using this, and there are a lot of people that does that. One of the other ones is called the opiate abuse. It is prescribed to reduce pain. Opiates cause withdrawal symptoms, which makes it difficult to sleep taking them. Examples are heroin, codeine, oxycodone, tramadols, different things like that. The things that there's a lot of people that's on opiate use nowadays that I'm learning a lot about. Back home when I was living in Louisiana, it had a lot of that too. So I know the feeling about that. Another one is marijuana abuse. It is a contained or cannabis despite clinically significant infamous causes, mood and anxiety disparate. Example is marijuana. It's getting to where there's studies of it that a lot of people are using it for medical use, but there's a lot of people that are trying to get it legalized. So I feel like if you have a physical need for it, I say yes to do it. But if you just gotta have it just to have it, I said no. But they have a lot of people that really needs the medical marijuana now, so I totally agree with it now. So, cocaine addiction, it is a biopsychological disorder characterized by persistent use of cocaine despite harmful consequences. Symptoms of it, you have dysphoria, depression, anxiety, weakness, pain, and compulsive wanting to eat. Cause some cravings. Cocaine use is really, really bad. Actually, I have an uncle that's suffering on cocaine really, really bad. He has these times to where he doesn't eat, and it has times to where when he do eat, it be very compulsive when he do. So I understand what he's feeling. There's also an amphetamine addiction. It is a disorder that has use to the following. If you have Adderall and Betazine, that's one of the main things too. Last thing is sexual addiction. It is a state characterized by compulsive particular engagement in sexual activity, even though it has a negative consequence, but they have a lot of people that have sexual addicts, so I understand that. Addiction exacts an astoundingly high financial and human toll on individuals in society as whites. Drug addiction is also called substance use. It's a disease that affects a person's brain. And to me, addiction is treatable and can be managed. People who are recovering from addiction will be at risk for relapse for years and possibly their whole lives. Treatment with therapy ensures the best chance of survival for most patients. Treatment approaches to loved ones to each patient drug use problems and only concurring medical, mental, and society problems can lead to continued recovery. So with these, I use www.drugabuse.gov, and I also use www.mayoclinic.com to help with this. But in my overall view of it, I say that drug addiction is very, very high and it's very, very real. And when people say that they need help doing this, they really do. So I feel like we need to really just help people if we can and really just be there for them to really get them through it. So in this example, I say to you is that I appreciate everything that you gave me the time to listen to my project, and hopefully you'll love it. If you have any other questions, you can just email me back, and I'll give you a wonderful feedback. Thank you, Mr. Joe, and I've had a wonderful time in this class, and hopefully you will be able to be there throughout this to see. Hopefully you'll see me graduate. Thank you.